Assessing the effectiveness, safety, and usability of electronic catheters for performing urodynamic studies. Research was sponsored by Library, speakers attendance by German charity fund Continence Research and Continence Awareness, Aachen, Germany. The primary aim of this study was to confirm that updated eSense urodynamic catheters are safe and effective for urodynamic use in adult patients. Exploratory aims were assessment of subjective patient feedback regarding discomfort and pain, and assessing subjective clinical users' feedback regarding device usability. Materials. Here the different updated 7 French eSense urodynamic catheter models are demonstrated. We see the single sensor abdominal with a rect connector, single sensor bladder and dual sensor urethral with the blue connectors. Before insertion to the patient, the catheters are connected to a urodynamic recording equipment and zeroed to the atmosphere. For the purpose of this study, the updated eSense catheters are connected to the medical measurement system Nexon system through a wireless patient unit interface shown in the left picture. Study approved by local ethics committee, conducted in accordance with the current version of the Declaration of Helsinki and in agreement with the International Conference on Harmonization Guidelines on Good Clinical Practice. This study included patients older than 21 years, medically indicated for urodynamics. Exclusion criteria were unable to give informed consent, active urinary tract infection, recent pelvic floor surgery, or pregnancy. The binary investigator response was used to assess the primary safety and effectiveness aim, clinically adequate, respectively inadequate, signalized success or failure. Exploratory aim was assessed by daily subjective questionnaire for clinical users containing ordinal scales from 1, meaning worse than, to 5, meaning much better, compared to previously used catheters. Numerical pain rating scale for all patients were used to categorize discomfort and pain directly after UDS. A telephone interview 3 to 5 days after the UDS to collect adverse event information was also done. Demographic results. 31 patients were recruited and 30 patients completed the study to support the primary composite safety and effectiveness analysis. The study population comprised 8 men and 23 women. Mean age was 54 years. 3 of the women underwent a urethral pressure profile using the dual sensor urethral catheter. Only 7 of 31 had undergone a previous UDS test, and 16 of 31 were neurogenic cases. The primary safety and effectiveness endpoint is a composite endpoint based on investigator response after each UDS using the eSense catheter to determine whether the urodynamic use of the catheter was clinically adequate, success, or inadequate, failure. A procedure was considered successful when the investigator determined the investigational device to be both safe and effective, assessed by the investigator assessment on CRF questionnaires. If these criteria were not met, the procedure was classified as a failure. The primary effectiveness hypothesis is a comparison of the lower bound for the estimate of the success rate to a minimally acceptable target value of 75%. In one case, catheterization failed due to anatomical factors, and therefore this patient was included in the sensitivity secondary analysis. Based on the overall analysis, both primary and sensitivity, significant p-values were observed. Therefore, the null hypothesis can still be rejected, and safety and effectiveness over 75% is consistent with the interim data. The subjective patient feedback was recorded for 3 phases of UDS: catheterization, filling phase, and catheter removal. The highest mean NPRS response was 1.2 for the bladder catheter during insertion, using a scale from 0 to 10. All other mean NPRS responses were below 1. Mean response for 3 patients with urethral pressure profile was 0.7. All patients would repeat UDS if medically necessary. During catheter insertion, 87.1% and 90.3% reported NPRS less than 2 for bladder and abdominal insertion, respectively. The subjective user feedback shows a mean value of at least 3.0. This means no different compared to water-filled or air-chopped catheters, up to a 3.8, which means nearly slightly better. For safety issues, this study revealed 11 adverse events affecting 9 patients, all classified as mild and short-lasting, less than 2 days. Only one unexpected adverse event, diarrhea lasting less than 1 day, most likely not related to the tested device. In conclusion, it can be said that newly updated e-cent electronic urodynamic catheters were considered safe and effective under the intended use. The catheter has a low patient burden, and the usability feedback indicated the catheters were as good or better than water-filled and air-charged catheters.